is Robert Nagy. I'm on the Samson Diabetes Research Institute board. Also, I should add that besides being a psychiatrist, I've had type 1 diabetes for over 50 years. So I've had some experience with both of these areas. And I'm here to talk about having type 1 diabetes, or actually diabetes in general, and coping with the COVID-19 pandemic that we're currently going through. As one might guess, having to deal with either one of those can cause a great deal of stress. And stress is a feeling of emotional or physical tension that is usually seen in reaction to an event, a thought that makes someone feel frustrated, angry, or nervous. And in the short term, that can be very helpful to make sure that something bad doesn't happen to us. But over a long period of time, like what we've been going through for several weeks, we have to find out ways to deal with stress, because that can be detrimental to our physical as well as our psychological health. Okay. There are recommendations that mental health experts make to patients with diabetes and having to deal with stress. And if you've been diabetic for any period of time, you're probably already aware of a lot of these and how effective they can be. What I'd like to do is remind everyone of those different methods and techniques and make sure they're utilizing them now, especially now. The first one is resiliency. The second one is exercise. Third one is resourcefulness. Fourth one is delayed gratification. And the last one is cheering your successes. Resiliency means an ability to recover from or adjust easily to adversity or change. In football, this is referred to as an audible, and those people who follow football know what I'm talking about. Examples can be, if you have diabetes, is a change in meal time, a change in the meal, a change in blood sugar, a change in exercise. All these changes constantly go on, and you cannot, as someone who has diabetes, have a firm fixed plan that is the same every hour, every day. We're constantly having to make adjustments. And at this time right now with the pandemic, all the changes we've had to go through between, you don't have to wear a mask, you need to wear a mask. You can go places, no, you have to be 6 feet away. You can only go to the market at certain times. All these changes are things that we're already ready to adapt to. Exercise is so important for all of us, whether you have diabetes or not. It's great for our physical health in terms of insulin sensitivity. It helps lower blood pressure, it improves lipid profile, but also what it does psychologically is it increases endorphins, and it acts as a very powerful distraction from stressors that are affecting us. Being resourceful is another mechanism or tool that is very beneficial. What that means is we're always looking to keep an eye on how to do something another way. Since I was a young child, I always knew that wherever there was coffee, there had to be sugar packets. That was a backup just in case my blood sugar was running low. Having diabetes, I always have extra supplies. It could be extra syringes, extra strips. So having that stuff is always real important, because then it allows me to have the mindset that no matter what happens, I got this, I'm ready for it. Having delayed gratification is something that we've had to get used to. For example, having to wait for the Humalog or Novolog to kick in while you're ready to eat. It could be waiting for a medication refill to get approved. We just have to be used to handling the delay to get what we need, because we know it's coming. And we have to remember to cheer our successes. Things that go well are not just okay, it's a victory. Because what we do every day is hard, it's not easy to do. We have to celebrate, for example, getting a good A1C, having a good eye exam, handling an unexpected diabetic situation, or a day when your Dexcom says that your numbers were in range. You have to pat yourself on the back, because that's a very powerful reinforcement that's great to have to get us through this time. The other thing to talk about is social interaction. I know we have to be very strict about social distancing. It's mandatory that we do that. But it doesn't mean that you don't have the social contacts. We have the telephone, we have FaceTime, we have emails, we have texts. Keep those up. We need to be in social contact, but don't be socially isolated. All those kind of things to do in terms of communication, that can be a very powerful antidepressant. We have to keep those in play. And the last thing is, if it's possible, have your doctor make sure you have a 3-month supply of all your medications and supplies. It's nice to have that as well. Thank you.